Thanksgiving was really different than any that we've had. I am so fortunate. I have an 85-year-old mom, and she is the absolute matriarch of the family. She is very vibrant. For 85 years old, she's very fortunate that she's still able to really get around. Her cognitive situation is great. But this year she just said, guys, I can't cook Thanksgiving. I'm tired. And I have three adult children, two daughters and a son. And so my two adult daughters said, okay, we'll do it. And then we all three split up the recipes, which my mom so graciously shared with us. And it was a little sad for her. She's so independent in so many ways, but this was the first time she wasn't feeling like cooking Thanksgiving. However, the girls did a great job, and at the end of the evening, it was so exciting because we always play games during Thanksgiving, and she said, "Well, let's play cards." My mom is an avid card player, whether it's bridge or spades, hand and foot, these things I've never even heard of. So she decided to play cards. Well, none of us knew how to play cards. So she taught my kids how to play cards, how to play spades. And you would have thought that we were having a full-blown just competition here. There was screaming and yelling and sharing, and it was amazing. And so what started out as kind of a almost sad Thanksgiving because mom didn't cook, it really ended up so incredible. And what a great thing that she passed and has given to my children now.
Well, hello, this is Don.
Hi, Don.
And Gina's quiet.
And this is Gina.
With Focus Healthy Family. And this is podcast number 89. And today we're talking about the complexity of caregiving, the caregivers. And we have our guest is Vicki Demirozu. Demirozu?
Demirozu. Good.
Okay. And before we do that, though, we want to take just a moment for our sponsor. Hey guys, it's Don here from Focus Healthy Family. And instead of our sponsor today, I wanted to take a few minutes to talk about the workshop we're doing based on this book. And we talk a lot about the book. We've talked about it in our podcast, How to Talk So Kids Will Listen and Listen So Kids Will Talk by Adele Faber and Elaine Majlis. And what we were so impressed with this that we decided to do the training, the training for it, and begin doing workshops on it. We've been doing them now over the last couple of years and have just been amazed by the changes that we have seen happen to parents who are dealing with kids and watching it changing how they communicate with their child, but also how it changes behavior and it changes anxiety. It brings anxiety down in the house. And like I said, I've had an added bonus to it is I use the same material, the same stuff that's in here for my adult world with my profession, because the concepts in this book, they give you real practical steps you can take to change how you communicate and make a difference between having a 15-minute conversation or a 1-hour battle. They tell you in here how to do that in many different ways. And so we do workshops. It's a 6-week workshop. It's a 2-hour-a-day workshop. But what we did is we split it into 2 days, 1 hour each day. We do it at noon Eastern time. And we have had people all over the world that have come onto the class, and really neat stuff. And I'm going to play for you one of the parents' testimonies on what they thought of the class. So listen and see what they said.
Okay, yeah, my wife and I decided to do the workshop. It was referred, Don and Gina referred us through our son's therapist, and we were having problems, or just I guess our main issue was just communication, and we were really working on that and read the book that related to the workshop. My wife did, and it really made a lot of sense. And we decided to do this based on the recommendation because it really helped us set aside time each week to develop practical skills to implement what we were trying to do. And we'd always have done a lot of reading and a lot of self-help things through books, but never have done role plays and different things like that helps really try to change our behavior and how we communicate. And we really are seeing a good benefit of this and already, and just really happy with what the workshop was able to do for us.
So starting January 9th, 2024, we're doing our next series of 6-week classes, and they're at noon on Tuesdays and Thursdays, each week for 6 weeks. And you're going to gain a lot of different skills that are very important. Plus, you'll have the opportunity to have other parents and listen to how they deal with things and what's going on for them, and literally working through examples, role playing, learning some good content to the book, and just having a good time too at the same time. We have a lot of fun while we do them. I hope that you can join us for this workshop. Again, it's all virtual via Zoom, and it's 6 weeks starting January 9th. You can find out more information by going to focusedhealthyfamily.com/workshops, where you're going to find out all about this wonderful workshop on how to talk so kids will listen and listen so kids will talk. Hope you join us again. focusedhealthyfamily.com/workshops. Thanks. All right, we're back. And Vicki, that was a great story. And, Gina and I, our family does a lot of the same thing. We always play cards. We play, now I got to look at, what's the name of what we play, Gina? The big card game we play? Hand and Foot, which is
Yes,
very
we
much
play
like,
hand and foot.
very much like spades in a way. So yeah, we used to have these big, huge, when my in-laws lived down on a lake, they had this big sunroom, and we would all, every holiday, every time we'd get together, it was a big card fest, so
Mhm.
that was a great story. And it kind of talks about, we're getting into talking about the aging group and caregiving for that aging group. So welcome, and tell us a little bit about you are with Giving Care with Grace,
Mhm.
and tell us a little bit about what you do in that caregiving capacity.
Absolutely. And thank you so much, Don and Gina, for inviting me to share and interact with you today. What a pleasure and an honor. Giving Care with Grace is an educational platform that is really focused on training caregivers in an area that's really, really not utilized much, and it's in the soft skill component. So there's a lot of training on the bathing and the dressing, the technical components, the technical needs of a caregiver. However, since the just crazy advent of all of the technology we have today, people really have lost the ability to effectively communicate. And today we're living in an area where we've got 7 generations. And so we've got caregivers that are newly emerging caregivers coming into the profession. A lot of the older caregivers are aging out. Post-COVID, they're tired, they're exhausted. And so we've got this dynamic where you've got a senior who grew up many, many years ago, and you've got these newly emerging folks that technically can do the job, no doubt. However, the communication part is just lacking. And so after 30 years in the industry, I managed offices, private duty home care offices for 17 years. And then after that, for 14 years, I was the national director of personal care and support for a major brand, Interim Healthcare. And I taught and trained owners, whether they had been in the business for a while, that were focused on Medicare or Medicaid, and the new owners, teaching them the nuances of the private duty business. And it was such a cool thing, because I took the years where I was in the business and was able to share and deliver that with others. The thing that keeps coming up is this turnover piece with a caregiver. 77% turnover last year, which is unprecedented.
Wow.
It's crazy. And that was something that we were all surprised, not surprised about. And a lot of that really does boil down to it's not necessarily the physical care again, but it's that interaction. The Maya Angelou quote, people will forget what you said or what you did, but they'll never forget how you made them feel. And so what Giving Care with Grace does, it's kind of people think it's a home care company. It's not, it's a training. It's a training platform. I've done in-person trainings, which are fantastic because you've got the caregivers really interacting. And I worked with professional caregivers and really worked with them in terms of, does this sound right? Are these the things that you're experiencing? I work with some of the more mature caregivers, some of the newly emerging caregivers that are like, well, I don't know what to do when she says this or when he says that. And so after a lot of interaction with the folks actually doing this, that's the birth of Giving Care with Grace. And really, it's a series of modules and lessons based on the soft skills, those human skills, interaction, communication, empathy, a lot of different components of that communication piece. We've even got scripts, and I share with them, it's kind of like anything that you do really, really well, you don't do it great the first time, whether it's playing a musical instrument or being in a sports situation. And so I want them to feel like it's okay not to know all the answers, right?
Well, yeah.
Caregiving for so many folks is a calling. But you know what? Some people are getting into it that haven't yet developed that calling. And so we're really helping to reframe. Caregiving isn't going to cook somebody a meal. I got to go cook Mrs. Jones a meal. It's my job allows me to enable a senior to stay independent at home and get to provide them with healthy, nutritious meals. And you know what? I feel so good when I leave Mrs. Jones home, and to help them really understand the impact. Seniors, 10,000 people are turning, 65 and older every single day. And the number is growing rapidly. I am in that group. And, we've got to really focus on teaching and training individuals how to interact, because again, so many of them were raised with a cell phone. I had the first cell phone I ever had was that big brick, right? I don't know if you all are, you may not be in that same zone.
Oh, but, no, we are. I used to sell those big bricks years ago. So I'm 65 and I've hit that place where I think I have to call myself a senior, which I don't like, but yeah, I get it. And well, and what Gina and I've talked about quite a few times is the complexity of caregiving too, because like you said, these skills are so important because they have to deal with multiple different things that are involved in caregiving, multiple diagnosis of a person. Each person can have different diagnosis of things. We're dealing with my father-in-law who has Parkinson's, dementia, and right now pneumonia that they're dealing with.
Yeah, I was going to jump in, Don, because I don't know how much Vicki, which kind of jumped into this interview, which we so appreciate, Vicki, without having to have a conversation before we did the interview. We appreciate that. So I'm an occupational therapist by background, working in geriatric rehab for 30 years. And so my dad went in the hospital, turned out he had COVID. Oh. And my mom is a healthy 80-year-old who takes good care of herself, but she has been his caregiver as his Parkinson's, and more difficultly, his dementia has declined since the onset of COVID because of isolation factors. And he has needed more assistance in that way because he's not safe to be by himself and those kinds of things. So she's dealt a lot with private caregivers. So everything you're saying, is just, and exactly what Don and I focus on is the communication part of it, because it makes such a huge difference. And I've seen that because I've worked with people with dementia and just seniors in general, and how important that aspect of it is, but it gets left out of training for sure. And so I'm from the hospital right now, just to let our listeners know and people watching on YouTube, I've got a mask on because my mom tested positive for COVID yesterday.
Oh, goodness.
And it's knocked her for a loop. They've never had COVID before. So I am staying at their house because it's about an hour plus from where we live, where Don and I live, so that I can help her out and help my dad out. So yeah, I'm I'm in the middle of stuff right now. So I just love to hear more about what you do because it is so essential.
Yeah, Gina, and I'm sorry they're having that situation and you're there. They're very fortunate to have you with all your knowledge. Sometimes that's a double-edged sword, right? To have a double-edged sword to have all of that background. But I think what you were saying about your mom, it's being a caregiver is such a demanding job. And to Don's point, so many different people need care, but the diagnosis is never the same. Because guess what? We're not the same. So person A with this chronic condition may have these needs as opposed to somebody with a cognitive situation or condition. And it's really, again, the bathing, the dressing, they may get more pushback from one person. Somebody may be able to help physically more than others. The cognitive piece obviously comes into it. And all of that is so important to have training. And the technical piece, the bathing, the dressing, the feeding, again, doesn't look the same for any two people, because if you have to remind Mrs. Jones to swallow, that's something that people don't even necessarily think of. And so the responses and how I've had such a privilege to watch these individuals work with clients and just have someone repeat themselves over and over. My grandmother had dementia for 15 years. She was so tough and strong, but unfortunately her mind, had that shrinking brain. And so just some of the magnificent ways that caregivers worked with her and taught my own mom, because my mom, in the beginning, oh, mom doesn't have anything wrong. Here I've been in home care for 1,000 years, right? And so I had her go to a support group. She came home that day and said, I think mom has dementia and Alzheimer's. And I mention that because I think sometimes too, we're very close to it because we're in that profession and we understand all of the nuances. But so many people, it's all absolutely new and foreign to them. And so to be able to understand, number one, what caregiving is, and to have the caregivers be able to navigate not only the physical components of the care, but that emotional component, those soft skills, really knowing how to, for example, okay, Mrs. Jones, it's time to get up and we got to walk. It's on the care plan. Mrs. Jones isn't ready. So it's about giving people those options and teaching the caregivers, absolutely, you're going to stick to that care plan because that is what Mrs. Jones requires and needs in order to live independently. However, there's a way to do it. Come back, say, Mrs. Jones, give her options. Would you like to take your walk now? Or do you want to have your coffee first? What works best for you? And I think simple things, losing your independence is so devastating. I personally had a surgery where I had to depend on people. And I got to tell you, I was a lousy patient. And I can only imagine, being even, up in years and being so able to do things and then having to depend on somebody. And so again, teaching and helping individuals share those best practices to how to get the best response, because words matter. You can either roar or you can purr and you get a whole lot better response when those words are used gently and kindly, when you know the signs and symptoms. Another thing Giving Care with Grace does is helps people recognize their emotional reactions, because everybody uses emojis today, right? And so what we talk about is, what emoji are you feeling right now? Are you feeling that smiley face? Are you feeling the zip lip? Are you feeling the red face? Are you, the one with the green stuff coming out of their mouth? And to help, again, the newly emerging caregivers identify, and we don't get into psychology, or I'm not a trained therapist. I do have a daughter that's a nurse practitioner in mental health and one that's a social worker, and I have run everything past them. It's not deep, but it's really to help people understand, I got really upset, and it really wasn't with Mrs. Jones. It was something she said that just got under my skin. So to really a clenched jaw, turning red in the face, understanding when you're starting to feel those feelings yourself so that you can take a step back, take a deep breath, take 5 seconds, close your eyes and breathe. And I know I'm kind of zipping around, but there's so many different components that really help individuals recognize and try to better understand situations that, again, they're not in the care plan, they're not in the caregiver training, they're not in the CNA schools. And so I'm just thrilled to be able to share that information. And I was working, I was in a skilled nursing community facility, and I was with some folks. Collectively, out of 6 of us, we had 130 years of experience, which was pretty incredible. And they walked away and they're like, oh, we learned so much. I never thought about it like that. Right. And so that was a huge, just great feedback.
Well, and thinking about it too, when we talk about like communication or, well, any of this for that matter, they're not only have to do this with the patient, they have to do it with the family. They have to do it with the doctors that are coming in. So it's learning how to communicate with all those different factors, which is all very different. How you communicate with the patient isn't how you necessarily communicate with the family, isn't how you communicate with the doctor. And they have to be able to understand different ways of communicating for those different factors or people that are coming into play into this. Does that make sense?
Yes, I have a section, and it's called Read the Room, because what I talk about as a caregiver with your daughter, for example, your mom wrestled me like a bear this morning when I was trying to help her. We know what that is, right? If you say that when the minister comes to visit or the next door neighbor, not so sure that they would really understand that. So exactly to your point, when you're interacting with a physician or a family friend or, religious individual that may come into the home, it's all different. And they have to understand that what you share, as communication with family isn't necessarily going to be the same. And a lot of us take things for granted, and you can't take anything for granted. And I think that's the beauty of it as well, is we are all, whether it's someone that just started caregiving or somebody that's been doing it for 30 years, we start the training at pretty much square one. And so that gives everyone the opportunity to either give feedback or to improve or to learn a whole lot of information.
Well, one of the things we talked. Oh, go ahead, Gina. Yeah.
I got some thoughts here, and I'm trying to keep myself muted while I talk because of the background noise here. I just love everything you do, and it just so aligns with the stuff Don and I do, because we started out our journey working with parents, dealing with children, and realizing this plays a role when you become the caregiver of your parents and you're trying to help them navigate that. And so, like, for me, I'm helping my mom be a caregiver for my dad. And right now, I'm having to be a caregiver for both of them. So yeah, that's how you say things, how you approach them, all that makes a big difference. I've been teaching that to my mom to help my dad, because he has dementia with delusions and agitation. And sometimes she says to me, I don't know what you said to him, but he calmed down. And a lot of times it's just listening to him and not reacting. But I know she's there. They've been married 50 plus years. She's there with him constantly. They've got that kind of nagging kind of relationship to some degree. And now that he can't just go off and do things himself, because he really doesn't have the cognitive ability to really follow through with things anymore. He was a huge card player too. And that was the hardest thing, to see him not be able to through and play a card game. So yeah, just a lot of times it's just knowing how to listen, knowing how to read their body language. I do this all the time because I've worked with so many people with dementia, and how you respond makes a big difference, especially someone who has a tendency towards delusions, hallucinations, any kind of cognitive difficulty, and even people who don't have cognitive impairments. It really makes a difference. Yeah, Don and I talk about listening and how a lot of times we need to just be quiet and let them feel heard. And so that goes true with kids. It goes true with aging people, even if people with dementia, even if you don't understand what they're saying, you can nod and
Absolutely. I'm nodding with you. Yes. Yes. And we laugh and joke about, Chick-fil-A has it down to a science. I'm not endorsing or not endorsing, but if you think about, and I talk a lot about that because you can go through a drive-through and sometimes leave feeling, wow, great, because you bought a chicken sandwich. And that needs to be the feeling everywhere that we give any type of care. And to your point about sharing with your mom, I had a similar situation with my mom, and I would say, Mom, it's best not to try to rationalize, because that's just probably not going to have the best outcome. And she's like, well, I'm not going to lie to my mom. And I said, well, we call them fiblets. It's not harmful to grandma or to you. It's not exactly the truth, but it's not a harmful untruth, right? And so I got to tell you, after years of it, she was a great storyteller, and her fiblets became quite good. But I think that's another thing too, from a generational perspective, that it's uncomfortable. Like you said, they're used to bantering back and forth, just because being together with somebody for 50 years, holy cow, you finish everything, right? Their sentences and all of that. And then to have to think that you can't correct them or say, well, wait a minute, what are you thinking? It's not like that. No. We didn't do that in 1962. We did it in 1955. And you can have 30-minute banter over that. Let it go. And I love that you brought that up, because it's I think probably one of the hardest things, and you as a clinician know better than I mean, it's one of the hardest things for families to relinquish is that trying to get them, steer them back on the right pathway, from that cognitive piece.
Yeah, well, a lot of what Gina and I started out with. We started based on a book called How to Talk So Kids Will Listen, and Listen So Kids Will Talk.
Yes,
And
that's back there.
yeah, and well, and I started to realize Gina, you probably did too, as far as we did it, we could use it on adults.
Yes.
The concepts on it, and the first one is about listening to feelings, listening to the children's feelings, but it comes so true to adults just as well. I've used it in business. I've used it in my coaching practice. All of that. So that's kind of how we got into it. And like I said, it's proven. Like I say, it changes things so much depending on how you respond or how you talk to somebody. It can make like we talk about, 15-minute conversation or not 1 hour battle. Which one would you choose? And that goes to what we're dealing with. Like you said, Gina, what did you say that calmed him down? Well, she just listened, and it changed the whole dynamic of how her dad reacted and or responded. So it makes a big difference.
Right. And I think, we talk about, are you tuning them in or are you tuning them out? Right. When you're working with clients, and it's the clients, it's the ancillary folks, the doctors, the friends, but it's also peers, because in caregiving, sometimes you have multiple people, whether it's in a hospital setting or a skilled nursing facility, or even in the home, if somebody has 24-hour care, and everybody's jockeying to do a better job, and sometimes they aren't kind to each other. And if they can learn to trust and depend on each other, as opposed to everybody sort of working in a silo. That's another area that whole teamwork component is huge in caregiving. And caregivers truly are the unsung heroes. I think they're the glue that is really can interact and really go with any part of the care continuum. It can be, post-hospitalization, prior to hospitalization. It can be somebody that's recently lost a spouse, just those basic types of things. And part of my mission, or a huge mission, is for every single caregiver to have the soft skills training. The other component is to really help elevate professional caregiving, and professional caregiving, and helping to educate family caregivers as well. Because again, with the population boom, people are, with medicine, they are living longer. And 90% of the folks, given the choice, they want to stay home. So we've got to educate ourselves. We have to educate each other, and to really empower caregivers to understand how to have the most success, because we don't want them to quit. We want them to stay and really stay in the healthcare system, whether they want to be a lifelong caregiver or to go into different types of education, whether it's an LPN or an RN. A lot of people are really taking that track. So that's my hope.
Well, I was wanting to see, you and I talked about the idea of talking about some holiday tips, because
Yes.
as this is going to air just a week or so before Christmas, I think you were talking about how important it is to kind of understand around holidays, there's a difference in how you got to deal with this. So maybe if you could give us, talk about some of the tips that you would give to somebody about around the holidays for their parents.
Right. And I think it's a great opportunity for people really to kind of do an inventory of what's going on with mom and dad. Some people come for Thanksgiving. Oftentimes they'll visit Mother's Day or Father's Day, especially long distance caregivers, and they don't get back until Christmas. And so indicators to look for potential decline, or somebody perhaps needing care. A couple of things, certainly their physical appearance. It's not necessarily anything major. It could be bruises. It could be, unkept hair. Mom was always immaculate, and all of a sudden she hadn't bathed in a week. She's wearing the same outfit every day and doesn't want to change, and has some coffee stains. Those are the subtle kinds of physical things. Smell of urine. Could be stacked up mail. Bills are being missed. Medical appointments are being missed. Dishes in the sink. I always laugh at that one, because if people come to my house, there are generally going to be dishes in the sink. But many individuals have been meticulous their whole life about their household, and you go in and just doesn't look the same. Mom doesn't look the same. The house doesn't look neat and crisp anymore. Sometimes they want to step away if they don't really want to participate in anything, and it's because of that loss of independence. If your hearing starts to go, maybe you don't want to go out and be in a social setting. Or if it takes somebody much longer to get ready because they are a little confused, they'll just say, you know what, you all go out. I'm going to skip it. So it's important to really kind of look at the physical signs that you see, whether it's with the person or the household, if their behavior has changed. Sometimes it's simply medication. They are taking too much, or they're not taking enough. Another thing that in home care, and certainly Gina, we run into all the time, is once folks become incontinent, they quit drinking, because if I don't drink as much water, I won't have an accident. And then they get a UTI, and that can sometimes mirror having cognitive decline. So things like, is mom drinking enough water? Does she have rotten food? Is she eating moldy food because her vision's a little cloudy? So there are a lot of little signs. Another thing that I, and that's for the holidays. So when you go in and you visit, kind of look out for those things. Another thing I think really important to keep in mind is try to keep it simple. Keep it simple. The simpler, the better. We get hyped up and everybody wants to have this grand celebration. But when you have a cognitive decline or a physical decline, you're tired, and it can get really confusing. you know, my grandmother used to just completely, like, if there were 5 or 6 people, you know, at holidays you have conversation and things are going on, and she would just get this sort of dull look and then get irritated and grumpy. And this was not far into her dementia. It was, but it's because there's too much going on. And so remove mom from the room. Things like not having this gigantic celebration. Maybe instead of having 20 people or 10, just have a couple of people. And you could even consider ordering out. Or if you do cook, include mom. Say, Mom, remember, you know, we used to make those amazing cookies. Which ones should we do, the gingerbread or the chocolate chip? What do you think would be the best? And again, going back to giving them those choices, it's something as simple as, what kind of cookie do you think would be best to bake? Simple things too, not maybe going to a celebration, maybe not going to the church choir or play. Just drive around during the holidays and observe the beautiful lights. Right? It doesn't cost anything. It's enclosed in a car, so they're safe, they're warm, it's quiet. So really to try to, again, simplify. And one thing, and I think you'll both agree, music, no matter what stage in life people are. I have seen people that really were nonverbal, and you play music and their eyes light up. And you're shaking your head, Gina. It's magnificent. So if you're celebrating Christmas, sing Christmas carols or play music from when they were younger, because that is something very simple but so enriching to somebody's life.
Yeah, music is actually accessed in a different part of the brain. So even people who are nonverbal, sometimes they can sing, because it's accessing a different area of the brain. So yeah, we see that all the time in the memory care units, where they're singing songs of people who don't usually talk, and that especially songs from their era, it stays in long-term memory, which a lot of times is less of an issue. And yeah, it definitely can play a huge component in affecting mood and feeling involved. And just, yeah, my dad likes music, and even just having something on in the background that he recognizes can kind of give his mind something to do.
Yes, yes. I had a client one time that was completely nonverbal, and she really struggled getting around. But she had a piano, and she could play like a concerto. It was amazing because it was all there. And she and her caregiver would go out and play the piano, and it was just so wonderful. I mean, it was incredible. But in terms of the holidays, I think really the key point with whether it's a family caregiver or a family member or a professional caregiver is to really kind of keep it simple. Because it's stressful. It's stressful for me. I think it's stressful for a lot of people. And so just to keep in mind that whatever we're feeling, they're probably feeling it tenfold. You can still enjoy and celebrate and have fun, but just tone it down.
Well, yeah, and to keep in mind what they may be going through, because I remember one holiday with my mom, I decided to get her a maid to come in and do cleaning beforehand, and she got so upset about it. I was shocked, because I thought it was the neatest gift to give her, she wouldn't have to worry about cleaning. But in her mind, she felt like I was telling her that she wasn't capable, and that she was losing her capabilities, And so it's the same thing with, we used to, there were a couple of times towards the end where we would say, Mom, you don't have to do any cooking. We'll order out, we'll get the local supermarket to do a whole turkey meal and all that and bring it, and it she thought that meant that she wasn't capable, and she wasn't. I mean, she was getting to the point where it wasn't fun for her to do it, but she didn't want to feel like she was incapable. So I think your idea of blending those two kind of together, bringing her in on the decision making of it, hey, I was thinking about doing this, how can, and getting her involved in it somehow. I think keeping them, so remembering what's going on in the back of their mind with a lot of this can be very helpful in what you do.
Right. It's really about maintaining their dignity as human
Yeah.
beings. And again, just realizing that, you know, many, if not most of them, had very vibrant lives, whether they're an introvert or an extrovert. Vibrant takes on many different definitions and many different colors, but to allow them to feel, we've talked about that, and to really respect that it's painful. All of this loss is painful for them. It's painful for us, but imagine it's much more painful. So if we have individuals that have the knowledge and have the understanding of how to interact to get that best level of response and to preserve the dignity that these individuals have, it's magic.
Yeah, one of the talks I did, I talked about taking keys away, you know, when they get to a place where they have, and I start out by saying, I asked people to remember when you were like 16 or when you got your driver's license, how exciting it was to grab that pair of keys and be able, have that independence and take off and
Yes.
expand your world, you know. Well, think about the reverse of that, you know, the contraction of your world and the keys taking away, and how that's going to feel to them, you know. And I think that's something we have to think about with all these different things, that loss of what they were so excited to learn how to cook, and now they
Mhm.
have to learn how not to cook or whatever. Um, uh, anyway, that just plays very heavy in their mind.
Yeah.
Yeah. I just wanted to jump in because you said quite a few things there, Vicki, that really spoke to me, as far as because I see this in the work I do and with patients and their families, that the family wants to start doing everything for them, even though they're capable of doing some things. And there's so many ways, like you're describing, to include them. I work at a place that has an independent living center, and the OT assistant I work with, she actually did some cookies with this person. This woman, she's got very mild cognitive issues. She has more physical limitations. Her shoulders don't move very good, and she misses baking. And so my coworker brought in boxed cookie mix that was real simple, and she did that with her as a therapeutic activity. And so that's the kind of thing that kids, grandkids, if mom likes to be in the kitchen, find a way that instructing the grandkids to do it, not have to do as much, or being a part of it in some way, rather than just, oh, don't worry about it, mom, we're going to take care of everything. When if that's what mom or enjoyed doing, or dad, that to them all of a sudden to not do anything is going to leave them feeling incompetent, not that they feel like they're not able to do anymore. And it definitely, the sense of the words aren't coming to me.
It's empowerment. I mean, they feel so minimized when, oh, no, let me do that. And I mean, I'm bossy, and my mom is very capable, and I still do that. And she's like, because we want to help. So what's delivered with a good heart doesn't always resonate, right?
Yeah.
It's don't take my keys away. And back to the key comment that you made, that's another area that families can look out for. That's a tough one, taking someone's keys, but look at the cars, right? Because sometimes they start banging, they bang into the mailbox. They pull in too close to another car, and they start getting scrapes on their cars. And believe it or not, this sounds kind of crazy, but one of the referral sources that some of our offices had were auto body repair shops, because they knew the seniors that would come in with dents on a regular basis. So they would drop their information off. It's just, everybody has a part in this whole caregiving piece. And it again goes back. I love what you all are doing. I mean, it really, at the end of the day, is about educating individuals and letting them know what resources are available.
Yeah. Well, speaking of that, this topic, there's so much to it. We want to have you back on, because we could take each one of these things we've talked about and make a podcast out of it, because there's so much to it. Like I say, a lot of complexity to it. So I really appreciate. What's that, Gina?
Said, yeah, I'm trying to chime in here. We certainly could. This is just, what you're doing is so in line with everything we do, and just the experience of what I've seen, and just there's so many great tips you've shared, and yeah, I just love what you're doing out there to help people with.
Well, thank you. And how fortunate your family is to have you there and your patients, and truly thank you. It's being a clinician is a very, very difficult, tough job. And I respect anyone in that healthcare spectrum. It's a tough, but much needed. And so thank you very much for what you do.
Thank
Well-
you. I appreciate that. My dad's been in the hospital 3 times this year, and what he said to people is his investment in me going to college for occupational therapy is well worth it.
Oh, goodness.
Well, Vicki, before we wrap up, just share with the audience, and I'll have it up on the website too. But share with the audience how they best can find out more about you and get more information about you.
Sure. I have a website, and it's givingcarewithgrace.com. Or if anybody would like to individually email me, please feel free to do that. It's Vicki, Vicki, at Giving Care with Grace.
Well, Vicki, thank you first of all for jumping in on this at the last minute and doing such a great job at let's see, kind of ad-libbing, I guess, a little bit here. That you know your stuff, so that shows itself, and we really appreciate you coming on. Such a great information, and like I said, we're gonna do more because
Awesome.
there's just so much to this. But thank you again for being part of this and sharing all your knowledge with us today.
Awesome. Well, thank both of you so much.
All right. Well, that's our podcast for today. We're glad that you were able to join us, and we hope that you enjoyed it. We hope that you'll share it with friends and whoever you think might find this information important. You can check us out on Facebook and Instagram. You can also go to our site, focusedhealthyfamily.com, where you'll find information about what we do, what you find out more about what Vicki does. And you can also get our blog. You can get our Tuesday tips. Every Tuesday we put out a very short podcast about little tips, effective tips for parents. And of course, Thursdays is our podcast. So again, thank you for being part of this. And remember, how you speak to your kids can shape their future and yours.